October is the month that calls attention to many worthy causes. Today, we want to call your attention to another one. Joining me now is Dr. Thomas Cordier with the New England Center for Cognitive Behavioral Therapy, and we're talking about depression today. Something that I believe in, feel free to jump in, flies under the radar sometimes, whether people don't want to talk about it or whether people don't fully understand it. Is that accurate, do you think?
Yeah, I think that's very accurate. We all suffer with depression from time to time. However, when depression gets in your way and you're unable to live your life to its fullest, you're having problems getting to work, having problems getting to school or to class, can't get out of bed in the morning, aches and pains, lethargia, which is tiredness, prolonged tiredness, a lot of sadness. I think that's when it becomes a problem. In mental health, we say that things don't become a problem until they really start affecting your life profoundly or someone else's life.
How do you, and is that really how you walk the line between maybe just general emotions that we feel on a day-to-day badness? On a day-to-day basis, people have worse days than others sometimes. So how do you define it as what's different from what you should be experiencing versus maybe it being something that you need to be a little more concerned about? Right.
Well, we all have sadness from day to day, or from time to time. That's normal human behavior. However, I think when the sadness is a daily thing, and it lasts maybe throughout the entire day, or like I said, it's disrupting your life in numerous ways, I think it becomes a problem.
Do you feel that people are hesitant to say or to almost admit to depression? Do you think that there's still kind of a stigma with it, that people don't want to put themselves into that category? How do we break that mold in society, really?
Well, yes, there is a stigma associated with it. I think the stigma is more stepping up and getting the treatment. People will talk about it with each other and to friends and sometimes to family members. In order to break the stigma, I think we have to talk about it more and say that mental illness is a serious problem and that we all experience it as human beings. 1 out of every 5 Americans has a diagnosis, and 100% of Americans struggle with negative emotions. It's part of being human.
And I would presume that it's not just about you personally understanding it, it's about those around you trying to understand it as well. It's family, it's friends, all kind of understanding where you're coming from at that period in your life.
Absolutely, Tara Joyce.
What do people do? What do they do? How do you move forward?
Well, the first thing you would do is seek help if it's starting to affect you, where you can't get to school or work, or you can't function properly within your family unit, or with your spouse or other half. So to seek help. And one of the first things to do to seek help is see your primary care physician, who can give you a referral. There's plenty of great online sites or information. All you have to do is Google depression or I-CBT Connecticut. I believe in cognitive behavioral therapy. That's my specialty.
And I know that you guys, and we're very happy that you will be joining us at the Health and Wellness Festival. Yes. What can people expect there if they stop by to see you?
Well, we're going to be doing validated depression assessments and checking people's scores. And if the score is low, we're going to suggest that they seek help, that they get an official diagnosis, and then seek treatment if needed.
All right. Dr. Cordier, thank you so much for being with us today. We really appreciate it. And again, learn more about our Health and Wellness Festival. Dr. Cordier will be there. It's next weekend, October 17th and 18th at the XL Center, Saturday and Sunday from 10 a.m. till 5 p.m. Best part, free. That's always nice.
Absolutely.
Turning now to